Hello, Daniel. I understand that you've been recently diagnosed with PSVT. To start today's visit, tell me about how you're feeling right now.
Well, right now I'm fine since I'm not currently having a PSVT episode, and I feel much less worried since I got a diagnosis and learned more about the condition. But that first episode was very scary. It came on without any warning. My heart rate jumped suddenly. It felt like a giant wallop through my whole body. I had shallow breathing and I was lightheaded and I was clammy and sweating. And I just immediately laid down on the floor and my friends were crouched around me and I knew it was my heart and I knew this cannot be good. So that was pretty terrifying.
Wow, that was terrifying. The symptoms of shorter and longer episodes can differ, but the longer ones often bring more anxiety and a sense of being out of control. Tell me, have you been to the emergency room with any of these episodes before?
Well, I have had hundreds of PSV episodes since that first one. And luckily, I've only had to go to the ER for it a few times. And that was very stressful. And that's exactly what you do not need during a PSVT event. But even when I don't end up at the ER, the episodes are hard because they strike without any warning. I could be driving, I could be working, eating, sleeping, anything, anytime, any place, and it just takes over your whole life for however long that episode lasts. And that could be a few minutes, it could be hours, it could even be days.
Wow. Thanks so much for sharing your experience, Daniel. As you know, misdiagnosis is common in PSVT due to the difficulty in accurately capturing an EKG recording on a monitor, especially for the shorter episodes. Another challenge that can take even more time for each patient to learn is to manage their own episodes. How has management been going for you?
Yeah, it took several years to get a confirmed diagnosis until one of the episodes was caught on a heart monitor. And that was frustrating and scary and kind of lonely. But even with the diagnosis, it's been difficult learning how to live with the condition and going through trial and error for managing the episodes.
Yes, that trial and error period is very difficult, but it's perfectly normal. As patients learn to manage PSVT, it does get better. I just want you to know you're not alone. We have two types of drugs that we use to treat PSVT. Rate control drugs that slow the rate of the PSVT down once it occurs, and antiarrhythmic drugs that actually stop the PSVT episode. There are other methods to better manage PSVT, which I'll help you learn so that you can try those at home. But first, tell me, how have you managed your episodes up to this point?
I have tried so many things. I've tried splashing ice water on my face and neck and bearing down like when I'm using the toilet. I've tried blowing into straws, and I've tried lying down with my feet in the air, a bunch of other things. What's working best for me right now is as soon as the episode starts, I just relax and start sort of deep breathing, and then I kind of hold my breath at the top of the breath. And that works. It doesn't work every time, and sometimes I have to try a few times, but that seems to be the best way of managing it now.
Yeah, it seems like you do have some great tools to manage your current symptoms, but I recommend on getting a smartwatch or a personal EKG device to help monitor your heart rate and length of an episode. It can help you decide when to go to the ER, and the personal EKG device can capture a PDF that you can send to your physician. You may also want to consider a recently FDA-approved nose spray that's a calcium channel blocker called etripamil. It can stop an episode when it occurs within 17 minutes. So you can have that with you to use once an episode starts to either avoid ER visits or use when you're traveling away from home. In the long term, though, as your episodes become more frequent and last longer, you'll have more symptoms, and the only curative treatment we have is PSVT slow pathway ablation. So you can think about that option once your episodes become more frequent and you feel you need it and you want to consider having an invasive procedure, but that might not be where you are at this point.
Yeah, I've heard about the ablation process. I don't think it's right for me now since I am able to manage the episodes, but I do like knowing that in the future, should that pathway be needed, it's available. And the nose spray treatment sounds great. And I'll think about getting a smartwatch.
That's great. Well, I'm here to answer any questions that may arise. Before we end our visit, I want to encourage you to discuss your diagnosis with your close friends and family. They can help you manage it and be supportive. So, do you have any other questions for me?
Oh, thanks, Kathy. I think learning more about my condition has helped me feel more empowered and less alone. And I have family and friends that have been so supportive and helpful, talking with them about my episodes even before I knew it was PSVT. That gave me a lot of comfort and a lot of support.
I'm so happy to hear you've already been educating yourself and your friends and family on PSVT and how best to support you during an episode. While you consider the additional treatment options that we discussed today, please reach out to me if you have any questions that come up.
Thanks, Kathy.